So can I just also mention Karen James and Sandra Jones from the physio department in Morriston, and also, oh no, we are on the bottom, and also Dr. Paul Temblett, who's a consultant intensivist, and Dr. Hayley Hutchins, who's this person who helped us put some of the statistics together. So I'm going to talk about an exercise program we've set up for post-ICU survivors. So if I just give you a little bit of background, first of all, critical illness affects over about 1,000 people in Swansea per year, and that carries a mortality rate of about 20%. What we're finding with these patients, and what a lot of research is showing, that severe weakness is very common, and this is quite a severe problem, and is something that we felt we needed to address when we've sort of had patients back in before the programme. They would report problems such as inability to climb the stairs, inability to go back to work, difficulty walking as far as the shops, or lack of confidence just to go to the shops. So these patients really were going home in a very debilitated state from hospital following prolonged critical illness, and it's something we felt we needed to address. And really, rehabilitation after critical illness is neglected when compared to other patient groups. So cardiac rehab is well established, pulmonary rehab is well established, but for patients who have survived ICU, there wasn't really anything out there, and NICE guidelines, which were brought out a couple of years ago for adults who've been through ICU. NICE guidelines suggest that trusts are starting to set up these clinics for patients where they're brought back in to meet a consultant, or they're often nurse-led, and to discuss any ongoing problems they might be having, whether it be physical or psychological. And from this program, from these follow-up clinics, a couple of different studies are going on, ours included, which look at then exercising these patients and seeing if we can improve outcomes through exercise. Okay, so the methodology we used for this study is a randomized controlled trial. So what we did, we either put patients into an exercise group or a control group. And the participants were patients who had been on ITU for 48 hours or more. And what's different about our study and our service is we include patients from the age of 18, and there's no upper limit, whereas all the other studies that are going on in the UK at the moment set an upper limit of the age of 65 or more. And if you think the types of patients who come through ITU, there's a large percentage who are easily now into their 80s. So we felt it was an important patient group to look at, but not to limit it to the under 65-year-olds. And it's also a very heterogeneous group as well, because with something like cardiac rehab, the patients are just problems with their heart primarily, for example, whereas with our patients, they tend to have problems with their heart, problems with the neuromuscular system, and all sorts of ongoing psychological issues as well, which I can talk about shortly. So the patients were actually recruited, as I said, from our consultant-led follow-up clinic, which is run by Dr. Paul Temblett and Karen James, the physio. And they're asked if they want to participate in our study there. And then from that, they're randomized into either the control group or the intervention group. They're randomized based on their gender, based on their age, so whether they're 65 or more, and also on their Apache score on admission to ITU. And the Apache score is basically a score which tells you the severity of that patient's illness when they come onto the unit. So that's just to make sure that we don't get all the very sort of fit and able people in one group, for example, the exercise group, and then all the sort of older, less able people in the other group, and obviously so we don't skew our results. The interventions, when the patients come to us, they're measured on a number of outcome measures, which include the 6-minute walk test, which gives us a measure of their cardiopulmonary fitness. They're measured on the Berg balance score, which gives us an assessment of their balance, because a lot of these patients are getting recurrent falls and are being readmitted to hospital with recurrent falls and the issues with that. We're also measuring grip strength to give us an overall impression of the patient's strength. And then 2 psychological measures, the SF-36, which gives us a sort of overall measure of their psychological status, and also the HAD score, the Hostile Anxiety and Depression score. Then, once we've done the baseline measures, the exercise group will do a 6 weeks exercise program where they come into hospital. They work one-on-one with Sandra Jones in the gym, and they will work for about 40 minutes to an hour twice a week for that 6-week period. I've just told you the outcome measures. And then the analysis, when we finish the study, we'll do the statistical analysis at the end, which will be things like student t-test. Okay, so a quick overview. Like I started saying, the patients are recruited from the follow-up clinic, and they're randomized into either the control group or the intervention group. They complete their baseline testing. They then do the 6-week exercise program, and then at the end of that 6 weeks exercise program, both the control group and the intervention group will be retested with the same baseline measures. They're then followed up again at 6 months and at 1 year, because we do find with the nature of ITU patients that the mortality rates and the sort of long-term follow-up is also very important to look at. At follow-up, we're also going to look at another of other outcome measures, including whether the patients return to work, use of primary care resources, and also mortality. Okay, so very early results. We've only sort of we've got about 10 patients in each group at this stage, but the very early results are looking very positive. On the 6-minute walk test, the patients in the exercise group have improved up to about 80 metres on average. That's actually gone up recently with a few more patients that have gone through since I did these slides. And the control group are actually losing fitness over the 6-week period. The Berg Balance score, on average, patients in the exercise group are improving by about a score of 3, and the control group are not improving at all. Some of the other results, which I hadn't worked out at the time when I did the slides, but I've since presented in another conference, what we're finding is depression is dropping significantly in the exercise group, but for some reason, unexplained at present, we're actually making our patients who do the exercise program more anxious based on the HAD score results. When I presented in the recent conference, it was suggested that perhaps it's the constant hospital, coming into the hospital for our exercise program, and that contact with the hospital, which is making them more anxious, but no real sort of explanation as yet. It's also been suggested that maybe it's their anxiety in wanting to improve because we've put so much into them in terms of our time and resources. Yeah, so that's the results. Grip strength shows an improvement as well on both the left and right hand for the exercise group, but we haven't done any sort of significance testing yet with these patients because we haven't actually put enough through yet for it to be worthwhile. But the trends look like it's a very needed program. And also, before I go on to the conclusions, what we sometimes ignore when we're doing research is the actual subjective feedback we're getting. And I think this has been, when the judges came out to our program, it was the first time we'd actually brought a group of patients back in, and some of the feedback was very positive in terms of, you know, almost that we're turning these patients' lives around after they've gone home. You know, we had sort of a number of patients who were, you know, under the age of 50, had full-time jobs before they came in. They were in hospital, they were in ITU probably for 3 or 4 days and in hospital for 10, 11 days, and they were sent home completely debilitated. One patient couldn't climb the stairs, she couldn't even lift a magazine, and that's the state we sent her home from hospital in. And she worked in Waterstones and was desperate to go back to her job, and like if she couldn't pick a magazine, she couldn't see how she could ever pick up books in order to go back to her job. So the subjective feedback's been very positive, but like I said, it's something that's quite often ignored in research, and this sort of, you know, it's not objective enough. But for us, I think it proved the worth of the study, and you know, hopefully, if we get the objective results to go along with the subjective feedback, then it's something that we can put out there for other people to do the same sorts of things. So, in conclusion, then, rehab in ICU survivors is recommended according to the NICE guidelines. And early results are showing that the exercise group has significantly better outcomes than the control group, except on anxiety. We've set this study up, or this program up, without any additional resources, any additional time or staff. It's just something we built into our caseload because we felt it was very necessary. And I think that sometimes is an example of how, you know, as clinicians, we recognise that something's needed, but we don't do it because we feel we haven't got the resources to do it. But actually, from the subjective feedback we've received, it's something we're really glad we brought in. This is one of our patients with Sandra in the gym, and the other photos already in the brochure, I think. That's it.
It's kind of a two-pronged question, I think. Do you think there is an optimal time post-illness to capture these patients? And as part of that, do you think you could actually start to do some rehab work whilst they're still an inpatient as well?
Yeah, oh, sorry, go on, Karen, you answer.
Have you ever had anybody, I'm just thinking, at what point do they start on the programme?
We tried to bring them back 6 weeks.
Post-discharge.
Post-discharge from hospital.
6 weeks post-discharge.
Discharge from hospital,
right.
yeah,
Okay.
not from ITU, because sometimes they're obviously on the ward for a few weeks post-discharge from ITU.
Okay. Thank you.
Should be ladies first, sorry. If you're able to do this without any more resource, what are you not doing now?
We're not doing anything, we're just, I suppose...
Because that's the problem for lots of these things. You really want to do them, but you just can't because nobody's got enough time. So is it just that you had an excess of resource before this and now that's fully occupied, or you're not doing something?
Oh, go on, Karen, as the manager of the team, you can answer that one.
That okay, everyone's having their lunch from 12 o'clock effectively, so that gives you from 12 to 1, which you can now more effectively use our time in a different way. And we also have been very, very stringent in looking at our service and seeing what things we can do, and there's a lot of things that you do historically that we've sat down and actually really leaned out our service to make sure that we're making things like this a priority and maybe not doing some of the routine stuff that we were doing in the past. I think with all of the financial things that are going on at the moment, I think it's a good opportunity to actually evaluate service and make sure that you actually are working on the things that make a difference.
Thanks. Is there a role for support workers in in this programme?
Yeah, Sandra's our physio tech, so Sandra's a band 4 physio with us. So the only time the qualified physios are involved in this is, well, Karen does the clinic, but the only time there's a qualified physio is if Sandra ever needs any assistance with anything, and thankfully she never does.
Right.
So it doesn't actually take any of the qualified staff's time. So yeah, we do use Sandra as our senior physio tech.
Ah, right. Okay, thank you.